right, thank you for those presentations. That's such a highlight of the work of our membership commission and all of you. All right, to present the ACR Global Humanitarian Awards, I would now like to introduce Dr. Howard Fleischon. Thanks, Howard.
Thank you very much, Kimberly. So this is the inaugural presentation of the Global Humanitarian Award. This award was established by the ACR Foundation to recognize fellow radiologists who are selflessly donating their time and expertise to improve the health of those less fortunate through radiology. As we establish these awards as part of our annual meeting, it is our honor and privilege to recognize these programs. In alignment with the ACR's mission, these programs remind us why we became physicians and highlight how radiology is making a difference for those with critical basic needs. While we're honoring several applications with awards today, I want to emphasize that this process made us all much more aware of the incredible work of very special people. It's our privilege to have the ACR Foundation associated with their efforts. So as part of this new process, which was adopted by the board last fall, the executive committee established criteria for awards. 16 nominations were received in one of 3 categories: individual radiologists, organizations, and non-radiologists. And again, the nominees that we received were very special people and very highly qualified. And we have 2 winners in 2 categories. So first, I'd like to announce the winner of the individual category, Helmut Diefenthal. Dr. Diefenthal is pioneered radiology outreach efforts through 50 years of dedicated service, primarily in Tanzania. The depth of his commitment is exemplified through his 12 to 14 work hour days, and he established the Kilimanjaro School of Radiology in Moshi, Tanzania. He established both the radiology residency program and the assistant medical officer and radiology program. The programs have resulted in over 100 graduates to date. With others, he helped establish the East African Medical Assistance Foundation, supporting equipment, volunteers, and the school he founded. And in 2003, while receiving an ACR honorary fellowship, he encouraged us all to become more involved in international outreach. It's with honor and very fitting that Dr. Helmuth received the first ACR Global Humanitarian Award in the individual category.
Dear colleagues, I thank you for giving me this award. It actually belongs to the Lord, who made me do what I did. I congratulate the board for the courage to recognize humanitarian efforts to help people who live in less fortunate circumstances. I say this because times have changed. In the years after World War II, the emphasis was on peace and rebuilding a world in which all can live. A few weeks after World War II, the French General de Gaulle met with the German Chancellor Konrad Adenauer to end 2,000 years of tribal warfare. Martin Luther King galvanized the nation in a drive to overcome past injustices and racial prejudice. Nelson Mandela and Frederick de Klerk achieved what no one thought possible: the peaceful transition of South Africa from apartheid. These days, in this country and the world, we see a recurrence of prejudice, the proliferation of hate groups, and the acceptance of war, especially by those who aren't going to fight it. What motivates a person to choose a life of service? For me, it was my faith. In the winter of 1943, I was a medic in a field hospital in the German army in Russia. Military action, infectious diseases, especially typhus, has killed all my predecessors. As a son of a Jew, I was treated as a lower human being. Then I made a promise to God that if I survived the war and the Nazis, I would choose a life of service. I did survive. Together with my wife, we became medical missionaries and served 35 years in Asia and Africa. We worked in multiple hospitals in Malaysia, in a 60-bed hospital in the remote mountains in northern Tanzania, and at the Kilimanjaro Christian University. The work of a medical missionary in the 21st century is different from that of Albert Schweitzer. We are no longer the only resource. We are part of a national system with doctors, nurses, and technicians who are trained, but far too few. We may still be needed in some remote places, but our most important contribution is in education. I opened my 2-year program in diagnostic radiology for assistant medical officer. 92 have graduated. We added a 4-year residency for medical doctors, graduating 17. I was asked recently, why should we spend money in developing countries when there's plenty of need even in the United States and in Canada? In my opinion, we should do both. We have poor citizens right here, but in developing countries, poverty is a fate of most. People in Africa and Asia should not be forgotten. If we ignore them, we shall not be surprised about the consequences. By the way, $1 spent in Africa buys much more health than in this system of ours. I lived and worked a long life and worked in 4 continents among humans of different ancestry and a variety of cultures. The most important wisdom I learned was that we are one mankind created by God to live in this world together. Thank you.
And I'd like to announce the winner of the category of international organizations is Rad Aid International. Rad Aid was founded by Dr. Daniel Malura in 2008 and has experienced rapid growth because of its success. Now has over 25 chapter organizations, has on-site chapter programs in over 10 countries with 45,000 web visitors at least per year, and established formal partnerships with 19 organizations. It annually sponsors a meeting bringing multiple stakeholders together to collaborate on improving access to sustainable radiology services, and has developed a radiology readiness tool providing systematic advanced assessment to plan for future growth. And he's also published multiple articles in JACR and also Radiology in Global Health. So it is my honor to present the organization category, the first Global Humanitarian Award, to Dr. Daniel Malura on behalf of Rad Aid International. Dr. Malura.
Thank you. I'm really touched by this, and I want to thank you all from the ACR for the award that you're giving to Rad Aid. I'm also humbled and really honored by the fact that you're giving me the honor to receive this award on Rad Aid's behalf. When Rad Aid started in 2008, it was just me And it was with a few other people at Johns Hopkins, and it was just with a sense that as a radiology community, we could be doing more for the developing world, places where poverty was quite stark. And the example of Dr. Diefenthal is before us as something for us all to aspire to, especially me, as I start out in my career with this. Now, as I stand here, thinking back to 2008, it's really amazing because it's no longer just me. As of this morning, it's 3,258 volunteers and members in Rad Aid. When that slide was made, there were only 25 chapters, and now there's 31. And when that slide was made, there was only 10 countries we were serving in, and now it's over 20. It's amazing the growth of Rad Aid, but it's on the back of so much enthusiasm and energy coming from the radiology profession, both the technologists and the MDs and the nurses and the physicists all collectively. I want to give you some examples of this because it's just amazing to me. It's brought so much joy to my heart to really grow Rad Aid as a vision for the future that brings radiology into places where there's so much poverty. When we started the Chapters program, the idea here is very simple. Rad Aid could do the work to make international service easier for radiology professionals. Let's provide the resources so that we can have overseas partnerships with hospitals and project development and resources for fundraising, and then let's let the universities where the chapters exist form their own projects using Rad Aid resources. And that is what has been such a channel for growth and has been such a source of courage at the volunteer level, because a resident at some institution will say to themselves, you know, I want to do public service, and I can do that by starting a Rad Aid chapter. And it takes a lot of courage and forethought and planning to really move that forward, because a chapter doesn't form without the approval of a program director or the chair of the department at that hospital. And as a result, 31 institutions now have formulated their own global health curriculum for radiology outreach through this resource. And it's amazing how much courage and how much perseverance it's really taken some of these individuals to get that done. Now, the second example I just want to give you as a sense of thanks is Rad Aid had a program in Nepal that started last year in 2014. We did a radiology readiness assessment, which was designed to collect and analyze the role of radiology in a country that didn't have much access to begin with. So we were already on track to doing work in Nepal, but then the earthquake happened. And we wanted to do more. So we put out the announcement that the radiology community could begin to serve in Nepal right after the earthquake. And we thought, well, maybe it's too ambitious for radiology to really be part of a crisis response. Well, the number of applications that Rad Aid received was stunning. And we formulated a team of 6 people who then went over last week. And these individuals didn't know each other at all when we formed this team. They were 6 individuals. One was from Missouri, one was from Pennsylvania, one was from Michigan, one was from London, one was from North Carolina, one was from Wisconsin. So they didn't know each other at all, but we were forming this team based on the glue that they believed in public service, and they believed that as a Rad Aid team, they could actually make a difference. Well, they went there, and enormous courage, enormous self-sacrifice. They were actually in the follow-up aftershock earthquake that happened last Tuesday. And then they were serving in communities that were later wiped out by a mudslide 3 days ago. The amount of service and vision and creativity that is coming from the radiology community for international service is so inspiring, and that's what gives me such an honor for serving as Rad Aid's CEO. And I just want to thank you for honoring all of that. And I want to thank you for everything we do together in partnership with the ACR, because the ACR has been a wonderful partner and supporter of everything. And I want to thank you, Dr. Diefenthal, for such an amazing example that you've set for all of us, so that hopefully I will aspire to the same long career of public service. Thanks again, everyone. I really appreciate this.